Thanks, Faris. Thanks, Lee, for the opportunity to talk in this social media residency to this wonderful audience. Lee, a few weeks ago, asked me to give a testimonial about my own journey as a physician in social media. I'm going to start saying that for a long time, I didn't see the value of working in social media as a physician, and I didn't see the benefits. But I was fortunate to attend an educational conference that was very focused on the use of social media, particularly in the free open access medical education movement. Since then, I have realized the power and the importance of being a physician in social media. I have worked quite intensively in developing social media education, and with the help of many people in this residency, we created a framework to provide academic promotion and tenure for physicians working in social media, which is rather an innovative thing and a very important thing for the future. One of the main reasons I'm here today is trying to say why you should do this, why you should be a social media physician, or why you should be active in social media. And the reason is very clear. It's our moral duty. And what I'm trying to say is the following. Social media provides a space, provides a domain, and our patients are there, our learners, policymakers, and society in general. It's a space that it already exists, and we need to occupy the space, because if we don't occupy this space, somebody else is going to do it. And who is this people who's going to use this space? And this goes from well-intentioned but misinformed people to quacks. And if we don't use this space, false information is going to be disseminated. And this is an example of what led to the current issues with anti-vaccination. 20 years ago, physicians didn't occupy this space. And this space was occupied for people who had some hidden agendas or people who's misinformed. And we see the consequences right now. So it's our moral duty to use this space because it's where our patients, learners, and society is. And we need to affect that discussion. Second reason is, as an academic physician or even as a clinician, academic media and social media offers you the opportunity to reach more people and to amplify the impact of your work. As a clinician, as a researcher, as an administrator, as an educator, you can reach far more people using social media. And whatever you do, you can amplify, you can help disseminate the impact of your work using social media. For example, for research, it's a great tool to increase knowledge translation and to actually be effective in healthcare. And last but not least, and which is what moves me most of my activity in social media, is a great place to learn. You can learn from a lot of people that you didn't have access to before we created these networks. Immediately comes the question of how to do this. And there's multiple papers. I will recommend a paper from Teresa Chan about how to be a 21st century digital scholar. But I will summarize a few things. First, you probably need to create your own professional digital persona. You need to create your professional account. And you need to be professional about it. And we have Faris Timimi lecturing about this during this residency, how to be professional in social media. And you need to be active in social media. You need to follow the following rules, which I call the C rules. You need to be creating a community. You need to collaborate. You need to curate. And you need to create content. And once you do this, you can harness, you can use the value of social media. You can learn, you can grow. And this is very important. And as a summary, my journey through social media is being from discovery a few years ago to actively working in creating content, to actively working in creating communities, to developing tools to help other people to engage in social media. Because social media allows you to participate in networks. And currently people, knowledge, and everything lives in networks. And the only way to access these networks and to manipulate and to benefit and to be impactful is using social media. You can grow, you can learn, and you can help your patients if you are a physician active in social media. Thank you very much.